prior to COVID already, inequalities across within countries were large and in many instances increasing. And COVID has only been a revelator of this, really, and perhaps only accelerated already existing trends. And the inequalities I'm talking about are particularly acute for human capital, education, and health. Rima has already mentioned this, but with school closures, millions of children worldwide have not been able to advance their learning. Many have dropped out, and there's a fair percentage that won't go back to schools, especially young girls. And evidently, the poor have been affected the most. So this is, as was said by my colleagues here, this is going to happen over generations. Now, health-wise, the poor have been most impacted by COVID, with greater mortality rates. We all know this. But beyond those direct effects, we're also seeing, or will see, numerous, perhaps worse, non-direct COVID effects, decreases in people utilizing essential health services, especially among the poor and those marginalized by health systems. I'm thinking about maternal care services, immunization services. We've seen, and we're going to see more, probably increases in incidence in diseases of poverty. So the picture is not looking great. Now, maybe a few signs of hope from my side. The first is, I think that this pandemic really demonstrated that social protection and public services, when working well, do not operate in silos. We lived all of this together across many countries. For countries, we saw that health performances were better where social and health services were integrated. In fact, actually, in many countries, the Ministry of Health includes solidarity in its own name. And recall, and I think direct health investments are just one means of redistributing taxpayer money and reducing inequalities. Now, inequalities are not COVID's creation. COVID accelerated those. We knew already that the middle classes, middle income classes were shrinking already, that the gaps were already at work, but COVID really put it at the forefront. So now moving forward, in short, a few avenues. I think we must design public and health policies with a major purpose of reducing inequalities. And reducing, Darno just said, we have limited budget and limited fiscal space. Reducing inequalities efficiently and cost effectively. How much poverty, how do I prioritize certain interventions which have the biggest return on investment from a poverty reduction standpoint? And the question about where it comes from, whether it's the health guy, the education guy, or the social protection guy, might be a secondary item. Now, if you think about health, that means implementing health interventions that maximize equity, reduce disparities, increase financial protection per dollar invested. That should be at the core of health insurance design. That should be at the core of universal health coverage and essential benefit package design. Health investments, in other words, take full part in the general social, or should take full part in the general social protection welfare agenda. And so in economic terms, the opportunity cost of health investments may not solely fall on the health sector budget, but also perhaps in the broader public social welfare budget. And I think that's really where we've seen, countries that do best often have these integrated thinking. And then lastly, what I would say is, as I mentioned earlier, is that obviously financial consequences of illness, productivity losses, wages lost, and so on, of a great number of conditions or effective and cost-effective interventions to present this condition lie outside the health sector. We have to think about intersectoral interventions, integrated public health and social protection systems, rather than the solely clinical care system.